Namaste Vidya, Amisha Kushraw Vidya. A very good morning to you all. Myself, JV and Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, in Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In today's lecture, we are going to discuss about the nephrotic syndrome. In this series of lectures, we have been discussing about the different diseases of the kidneys. Till now, we have discussed about So let's start with nephrotic syndrome today. What is nephrotic syndrome? It is a very important and very common syndrome that is affecting a lot of population these days. Nephrotic syndrome is a very commonly encountered disease these days. So we must know the details of all these diseases. In the previous lecture, as I have just discussed with you, that we have covered urinary tract infection, we have discussed about acute renal failure, we have talked about the chronic renal failure, etc. etc. So in today's lecture, let's start with nephrotic syndrome. What is nephrotic syndrome? What is the etiopathogenesis? What are the different clinical features? What are the various investigations? And how to manage such cases will be discussed in this particular lecture. So what is nephrotic syndrome? Nephrotic syndrome, it is a clinical condition that is characterized by a few features. The features, just by looking at the patient, you can say that there is swelling. If a child is having nephrotic syndrome, then the child will be swollen. And clinically, it is presented by edema, there is swelling, and there is proteinuria, that is excessive proteins in the urine, and hypoproteinemia, that is decreased protein content in the blood. So nephrotic syndrome is characterized by three things. We have three things in nephrotic syndrome, that is edema, we have proteinuria, and we have hypoproteinemia, irrespective of the etiology. So in nephrotic syndrome, the exact etiology is not known, but the outcome is we will have edema, we will have proteinuria, and we will have hypoproteinemia. And the pathology is not known. The etiology is not known. What is the exact cause for development of edema, proteinuria, and hypoproteinemia? There is heavy proteinuria that is greater than 3.5. It is a clinical condition. Nephrotic syndrome is a clinical condition that is characterized by heavy proteinuria of greater than 3.5 gram per 1.73 meter square body surface in 24 hours. It is associated with, we have hypoalbuminemia, there will be edema, there will be hyperlipidemia and hypercoagulated states. So the nephrotic syndrome is characterized, or it is associated with hypoalbuminemia. It is having edema. There will be hyperlipidemia and hypercoagulated states. Hypoalbuminemia, edema, hyperlipidemia, and hypercoagulated states. Now, what is the etiology? Etiology for development of nephrotic syndrome. Exact etiology is not known, but there are certain theories that are given. Number one, we have idiopathic cause, when the exact cause for nephrotic syndrome is not known. Next, we have primary glomerular diseases, and the next is the secondary causes. So when we have the idiopathic causes, when the cause is not known, next we have primary glomerular disease. The next we will have secondary causes. In the primary glomerular diseases, there will be certain categorization that we will be discussing in the glomerular nephritis. There will be minimal change disease or the minimal change nephropathy. Next is there is focal segmental glomerulosclerosis. The third is the membranous nephropathy. The fourth is membranoproliferative glomerular nephritis. And the fifth one is IgA nephropathy. So in the primary glomerular disease, there will be minimal change nephropathy. We will be having focal segmental glomerulosclerosis. There will be membranous nephropathy, and membranoproliferative glomerular nephritis, and IgA nephropathy. We will be discussing about each and every primary glomerular disease later in this chapter in very detail. Next is the secondary glomerular disease. So we had first discussed about the primary glomerular disease, which includes minimal change disease, focal segmental glomerulosclerosis, membranous nephropathy, membranoproliferative glomerular nephritis, and IgA nephropathy. In the secondary glomerular disease, there are infections that is bacterial, viral, protozoal, helminths, etc. So primary was related to the kidney itself, whereas the secondary glomerular disease is the disease that is affecting or that is occurring because of some secondary cause. So the secondary cause includes infections. We will have neoplasm, we will be having drugs, multi-system diseases, familial and metabolic diseases, and miscellaneous. So in the infections, there will be bacterial, viral, protozoal, and helminths, etc. The neoplasm, there will be solid tumors of the lung, stomach, breast, leukemia, etc. There will be drugs, different type of drugs, which includes NSAIDs, penicillin, gold, mercury, etc. The patient will have multi-system disease, which includes SLE, rheumatoid arthritis, and amyloidosis, etc. There will be familial and metabolic diseases, which includes diabetes mellitus, Graves' disease, etc. And there will be miscellaneous. Miscellaneous consists of preeclampsia, malignant atherosclerosis, and obesity, etc. So in the secondary glomerular disease, there will be infections that are caused by bacteria, virus, protozoa, helminths. There will be neoplasm, solid tumors of the lung, stomach, breast, leukemia, etc. There will be different type of drugs, which includes non-steroidal anti-inflammatory drugs, penicillin, gold, mercury, etc. There will be multi-system disease, which have SLE, rheumatoid arthritis, and amyloidosis. There will be familial and metabolic disease with diabetes mellitus, Graves' disease, etc. And miscellaneous, which includes preeclampsia, malignant atherosclerosis, obesity, etc. Now, what is the incidence and clinical features that we are going to see in this particular case, in case of nephrotic syndrome? So, age and sex, nephrotic syndrome is most commonly seen in the children with peak incidence of 2 to 3 years. So, it is common in childhood with peak incidence of 2 to 3 years, and male is to female ratio is 2.5:1, and it is equal in adults. So, age and sex, it is common in childhood with peak incidence of 2 to 3 years. Male is to female ratio is 2.5:1. That is, it is more common in males and equal in adults. The edema. So, there will be peripheral edema that will be seen in such cases. Edema with lower limbs getting affected and abdomen affected in children. So, there will be edema, peripheral edema with the lower limbs affected. The face, abdomen is affected in the children. And there is also generalized anasarca, that is generalized swelling. In the GI system, there will be symptoms of anorexia and severe malnutrition. So we will be having symptoms of anorexia, there is no desire to eat, and malnutrition. There will be diarrhea and vomiting due to edema of the intestinal wall. General features includes anorexia, lethargy, tiredness, frequent infections and muscle wasting, with dyspnea may occur. Blood pressure includes hypertension, symptoms of hypertension. So it is more common in children with a peak incidence of 2 to 3 years. In children, we have male is to female ratio 2.5:1, that is more common in males. And in the adult, the ratio is equal, the same. Clinical features includes edema, that is peripheral edema with lower limbs, and face and abdomen are affected in children with generalized anasarca. The GI system includes the anorexia with severe malnutrition. There will be diarrhea and vomiting due to edema of the intestinal wall. There will be general features which includes anorexia, lethargy, tiredness, with frequent infections and muscle wasting, with dyspnea that may occur. The blood pressure, like symptoms, we have hypertension. Now, what are the various investigations that could be done in case of nephrotic syndrome? Whenever a patient of nephrotic syndrome is coming to us, what are the various investigations that could be done? So the lab investigations includes the urine examination and the blood examination. And if nothing is clear from these two, then we have to go for renal biopsy. In the urine examination, we have to check for oliguria and proteinuria and presence of fast. Oliguria, there will be reduced concentration of the urine. Proteinuria, that is protein loss in the urine with greater than 5 grams per day. There will be cast and fatty cast that will be present. In the blood, there will be anemia. Anemia, that is normochromic anemia with hypoalbuminemia, hyperlipoproteinemia. These will be seen. So in the blood, we will be having normocytic and normochromic anemia. There will be hypoalbuminemia. There will be hyperlipoproteinemia with renal biopsy. Now, what is the prognosis in case of nephrotic syndrome? Whenever a patient of nephrotic syndrome is coming to us, what is the prognosis of that particular case? 90% of the children responds very good to the prednisolone or the steroids. And adult response rate is around 60%, but the relapse rate is very high. So in the prognosis, 90% of the children will respond to prednisolone with a high adult response rate of 60%, and the relapse rate is very high. Now, how to manage a case of nephrotic syndrome? The management of the nephrotic syndrome includes fluid restrictions. We have to restrict the fluid in the patients with low sodium diet. Low sodium diet is advised, and the fluid restriction is done. Rest is advised. Proper rest has to be taken. Low sodium diet, low fluid diet, and these helps in controlling the edema that we are seeing in the patient. Corticosteroids are given. It produces rapid and complete remissions. And also immunosuppressive drugs are given, which include cyclophosphamide. So the management consists of general management, which includes fluid restrictions and low sodium diet, rest, and it helps in controlling the edema. Corticosteroids, which produce rapid and complete remission, and immunosuppressive drugs, that is cyclophosphamide. In the homeopathic management, various medicines are given according to the symptom similarity. Some of the indicated medicines includes Apis mellifica, Apocyinum cannabinum, arsenic album, terebinthine, Kaliars, phosphorus, and plumbum nut. So in the homeopathic management, we have Apis mellifica, Apocyinum cannabinum, arsenic album, terebinthine, Kaliars, phosphorus, and plumbum nut. So this was all about nephrotic syndrome. And now it's your homework to complete all these medicines. The name I've given, you have to write the indications of all these medicines. And you have to also write the answer of the question that is given in your e-notes, that is define nephrotic syndrome, and write down the etiopathogenesis, clinical features, investigation, and management. In the next lecture, we are going to discuss about nephrolithiasis. So this was all about today's lecture. I hope you have understood this session properly. This session is powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope the session is clear to you. If you have any query, please mention in the comment box and I will try to resolve it. So this was all for today. Thank you very much. Have a good day.